Thank you. Just want to again recognize Olga's remarks. It really reflects the importance of commitment, national commitment that was represented by Egypt, that's emerging in Pakistan, and that's represented even under times of stress in Ukraine. I'd like to talk about, give you a little bit of an update of the Lancet Commission and really focus on the data source for that, the National Hepatitis Elimination profiles that were referred to by Olga from Ukraine. I have Graham Cook with us here today, who's the leader of the update of the Commission report that's brought together by the Lancet. That's focusing on the 20 most heavily burdened countries with hepatitis B and hepatitis C, and to assess their progress. That commission update is still in development. It's scheduled for publication in February of next year. So I'm really going to focus on the data source for that commission, which is the National Hepatitis Elimination profiles that we bring together as a coalition that assembles data regarding the plans, the policies, the programs, and progress toward elimination in countries. We have developed over 30 of these to date, as you can see here in the map, with an additional number that's in development, and I'll be focusing on those that have been developed to this point. The profile data that I'll show you is coming from the countries that do represent the large burden of hepatitis B, as shown here in regards to hepatitis B-related mortality and hepatitis C-related mortality. The process, we do a systematic review to identify information that's been published or is available on the web. We then share that with partners in civil society, ministries of health, clinical experts as a verification step and to identify additional credible data sources. And then we bring that together in a profile that can be used to raise awareness and guide priority setting in those countries. I'm going to show you some examples of data from the profiles in the areas that are shown here. As far as national planning, you can see here that most of the countries with the largest burden of hepatitis B and hepatitis C do have national plans for hepatitis B and hepatitis C elimination for the most part, with some elimination goals that are being recognized. One of the biggest challenges that's revealed is the limitations in strategic information, as Fumi referred to, with the large number of countries that do not have reliable data to track incidence or to track mortality. Similarly, there's some challenges in getting good data to track the numbers of persons being diagnosed and treated. The data is a little bit more readily available for hepatitis C, less so for hepatitis B in these countries. I think the greatest progress has been made in the elimination of mother-to-child transmission. We can see about 60% have adopted a hepatitis B birth dose vaccination policy, and over 80% have routine screening of HBsAg of pregnant women. About half the countries have achieved this interim target of at least 50% birth dose vaccination coverage, and about the same percentage achieving a 90% three-dose vaccination coverage for infants. Most countries have achieved the interim target of less than 1% prevalence among children less than 5 years of age, with a few remaining to reduce that percentage. And as you can see, there a sizable percentage have already met the 2030 goal, at least with the information currently available. Looking at expanding access to hepatitis B and hepatitis C testing, most countries have some type of testing policy, whether it be risk-based or some type of general population-based or birth or age cohort-based, in part governed by their epidemiologic context. And about half have eliminated co-pays, which is a financial barrier in many cases for their countries. And we still have some work to do in expanding access to point-of-care testing, which can help bring testing and diagnosis and treatment closer together. As far as expanding access to treatment, a similar high proportion of countries do have treatment guidelines, with about half eliminating any requirement for patient copay for access to those treatments for hepatitis B or hepatitis C. Similarly, there has been some efforts of simplifying HCV treatment policies, but I draw your attention to the allowing non-specialists to prescribe treatment. As you can see there, that's only about half of the countries allow that, with a requirement for specialists for the remainder, and that can often be a challenge when specialists are in short supply or requiring transportation or additional cost on the part of the patient. This leads me to opportunities to bring these different aspects of putting together good prevention, testing, and treatment policies. Then you can begin to make some comparisons across countries. Now, this is a little bit different than the bronze, silver, gold grading that Fumi referred to, in the sense that you have to have a program that's pretty far along to even get to the bronze stage. We're really looking to see if there can be some numerical indicators that can identify programs getting started and progressing at an earlier stage, and where by their numerical changes you can recognize advances that can promote a better investment, because they see that progress is being made and is being recognized. So I see this as sort of a way of an earlier stage in grading that progress, and you'll see some of this scoring that will be a part of the Commission update that will be coming out in the first quarter, and that we will begin to make a feature on the Global Hepatitis website. And to help you compare countries, we will be updating our web features in the first quarter of 2024, so you can do a side-by-side comparison when you wanted to select countries that are relevant, whether by region or for some other factor. You can begin to make this type of comparison that can be helpful for your efforts. So in summary, most countries have national plans for hepatitis elimination. Most countries have policies for hepatitis B and hepatitis C testing and treatment, but there needs to be some revisions in those policies to remove barriers to hepatitis B and hepatitis C testing and treatment, of which I gave you some examples of. And we have a big challenge with improvements in strategic information, with some ways forward, as illustrated by Fumi in her presentation. And I believe these profile process provides a resource for cross-country comparisons for elimination policies, programs in progress, which can help motivate improvements in those programs across countries. I want to thank all our collaborators, many of whom are in the room today, or a number are in the room today. We had a meeting of our advisory committee yesterday, and all of this information is available on our website at globalhep.org. Thank you very much.